I've spent many years talking to people about how they access healthcare. Most of that talk has been how they cannot access healthcare and have suffered severe consequences. One of the saddest and most difficult stories to hear is when a person tells me how their loved one could not access healthcare and died as a result. Courtney graduated from college and got a job that did not provide healthcare benefits. So that meant that she would have to figure out how to get her type 1 diabetes supplies and insulin on her own. The insurance companies could discriminate against Courtney because she had a pre-existing condition. She had type 1 diabetes. She was always going to need medicine and supplies, and the insurance company chose not to sell Courtney a policy. This was back before the Affordable Care Act, when discriminating against someone for having a pre-existing condition was still permissible. It no longer is. However, buyer beware. Short-term policies and health cost-sharing ministries can discriminate against someone for having a pre-existing condition. Health cost-sharing ministries aren't even legally considered insurance. They are not obligated to pay members' bills. Today, healthcare reform being what it is, Courtney most likely could have bought a policy on her own on the exchanges and received financial help, a subsidy based on her income. She could have stayed on her parents' health insurance policy. The healthcare law says young adults under 26 can stay on their parents' policies. There would have been options for Courtney, but as it was, at 23 years old, out working on her own after graduating from college, Courtney had to figure out a way to get her own medicine, and she did. She bought her supplies and her insulin, and she decided that she was going to try to save a little money, and she cut back on her dosage. Courtney needed insulin to live. She was diagnosed with type 1 diabetes at 14. She did not let her family know her struggles trying to buy her medicine. She tried to manage it on her own, and she cut back the dosage. And one night her friends were going out, but Courtney was not feeling well. She said to her friends, "Go out without me, I'm fine." And they tucked her in bed thinking she had the flu, and Courtney never woke up. Courtney died. She went into a diabetic coma and died because she did not inject herself with enough medicine. This is what lack of access to healthcare can look like for too many people. I have told you the story, and our brains want to tuck it away so that we don't feel too uncomfortable. We can say, "That's awful." But can we imagine being Courtney's mother? Can we imagine Courtney's cold body lying in bed? Can we imagine her friends discovering Courtney dead? Can we imagine the phone call that one of her friends has to make to her mother? Can we imagine her mother hearing the news of her grown daughter's death? Can we imagine? Can we imagine what's it like after the shock, and her mother, after a very long day, puts her head on her pillow and weeps and weeps and feels the energy run through her veins, and her head explodes on fire, and she lies in bed through the tears, and maybe she screams, and maybe she is angry. She is angry. Angry. And maybe she yells, "Ah!" And maybe she cries herself to sleep. Our opinions and policies affect real lives. If all we ever did was vote for people who stand for the kind of change and policies we support, it would be enough. It could save somebody's life, like Courtney's. One vote matters. We have to have courage to put ourselves in Courtney's place and in Courtney's mother's place, and then choose our actions from that knowledge. That is deliberate compassion.